Good afternoon, everyone, and welcome to your weekly Med Group Town Hall here at Takata 2, the center of the aerospace testing universe. For those that are tuning in for the first time, I am Gwendolyn Foster, your medical group commander, and with me today is Captain Aaron Lankert, our public health officer, Captain Hoffman, our mental health psychiatrist, along with Miss Arlene Johnson, our social worker, and to be able to get all those questions from you is my right-hand woman, Chief Bradley. And so to kick us off again with the current situation is going to be Captain Lankert. Captain Lankert?
Awesome. So if the slides can be put up. There we go. All right, so this is the current site picture. You've seen this every single week. Still widespread transmission across the U.S. California is still staying kind of in the top states, but overall the situation's rather fluid. One thing to highlight, there are other countries around the world right now that are starting to see more relaxed restrictions. So the U.S. is starting to have those discussions as well, but at this point in time, we're still, at least as California in our little bubble, definitely an area of high transmission, and that's going to be highlighted on the next slide. There we go. All right, so that's the local site picture. So this is basically highlighting what's right outside of our gates. So most importantly, since everybody's pretty much seen these slides every week, most importantly in the bottom left corner, you'll see all the new cases per day. You'll see a really drastic spike there, especially for basically Palmdale. So a lot of that is being driven because there have been a lot of backlog test kits that LA County is currently cycling through. So over the past 3 days or so, there have been about 1,200 new confirmed COVID cases per day. About 400 or 500 of them per day were actual true new cases. The rest of them were because of this backlog. So definitely expect to keep seeing spikes like that in the near future as they start to open up the actual analysis part of the testing, because getting the samples was one thing, but actually going through with the lab testing was a little bit delayed, even though we still had a decent amount of lab kits. So you'll see that reflected in the spike. It kind of dilutes the data a little bit, but just nothing really to be too alarmed about, besides we're still kind of going up on that upward trend. Overall, another thing to highlight though, because a lot of those test kits were in Palmdale, which kind of leads to their stark increase, it's important to note that outside the gates, we do have areas in the community, especially Palmdale, where this disease has been basically simmering at. And even though we didn't have the confirmed eyes on, it's an important thing to remind everybody that this is definitely in our local community, and there are definitely still hot spots, as you can see on the map in the bottom right-hand corner as well. That's pretty much the best way to show that, is we are basically in the eye of a storm here. Even though Edwards might not be as impacted, everywhere around us and the places we visit are definitely feeling the impacts of this disease. Next slide.
Thank you, Captain Lankert. And I know most of you have seen this slide regularly as well, but again, it is the foot stomp that we are here for you and our doors are open to provide your healthcare needs. So please continue to call our appointment line. All our services are available, and that's to include our ancillary services. To talk about our ancillary services, specifically lab, we are able to test. I know that question comes up a lot. We continue to pursue other avenues to be able to provide that in-house testing, but we are able to test and ship out when we perform that test. And right now, our current turnaround is averaging about 48 hours. So again, our doors are open. All our services are available. And also, we continue to stay in close contact with our local community partners, Palmdale, Antelope Valley, Tehachapi, and they are meeting our community healthcare needs as well. Right now, overall capacity, they are not even where they are overwhelmed in the least. They have their PPE that they're needed to be able to take care of our COVID-19 patients, as well as they are able to have beds available. So as I get more information to share with you, I will continue to share that. But right now, our healthcare partners outside our gates are doing well, and they are all postured to be able to surge if the need arose. And now I'm going to turn it over to Captain Hoffman so he can give a mental health update on how we can remain resilient throughout this journey. Captain Hoffman.
All right, so today's topic is resiliency. Of course, we know this word like through and through by now, right? And this is how we basically stay sane during this time. It is, it's kind of troubling. It's kind of uncomfortable right now, but there are things that how to do to stay sane right now in your homes or isolated from other people. And so resiliency is something that we all have, we're all capable of, and that we have in our pocket. But right now, I'm just going to give you some tips and remind you to stay resilient. Sometimes that's all we need is a reminder to pull out those things and those tools that we have in our pockets. And so during this time, of course, the biggest thing for us to do right now is to accept what's happening right now. Accept what is. Don't worry about the future. The future will come. We'll figure out when we're opening up. We'll figure out when we'll be able to interact with our friends in social settings again. Figure that out later. But right now, accept that we are in a pandemic and that we cannot go outside and interact with each other right now because we are trying to stay safe and keep those numbers down. And so with accepting it, of course, you have to come with the flexibility of what's happening. So a lot of us have transitioned to working from home now, and that's been a big thing. And we have new information rolling in every single day about this virus and about what we should be doing to protect ourselves. Listen. Probably turn off the news that may be anxiety-provoking. Maybe check it once a day. Don't listen to it all day long because they're giving you things that are probably making you fearful or angry or all those things. If you feel those things, check it. Control your emotions. Turn off the TV. Take care of yourself. That's a big one. Obviously, you're in the house, you're adapting to this new environment. We're used to being out of the house and going to work, coming home, going to the gym, all those things. Continue to do all the things that you need to do to take care of yourself. Of course, get the amount of rest you need, sleep, eat well, eat your vegetables. That's one thing that I'm struggling with. Continue to exercise. So a lot of people are learning how to work out at home. But the other thing is the air is not toxic, people. You can still go out and go for a run or do whatever you need to do. But go outside, get some fresh air, get some sunlight. You do not have to stay in your homes. It's people that's the problem, not outside that's the problem. Remember that. And then utilize all of your positive coping skills, those things that you learned how to do, to meditate, to listen to ocean noises and things like that that can help you calm down if you are anxious, those types of things. The next thing is to maintain your routine. Of course, we are typically outside, going to work, going home, going to the gym. Still, you have to make an income. You can still work from home. Those who are not working right now, still get up in the morning time and do things during the day. And then it'll help you once it's ready for once it's bedtime, so that you can rest a little bit easier. So create a routine. That goes for everyone in your household, the kids or your spouse and all those. So the routine is needed. Maintain positive social connections. So I hate it for those of you who don't like your kids, but stay in the house, make sure that they're doing well. Try to enjoy your company. A lot of us don't have kids or a spouse or anyone in the house, so enjoy that, cherish that. But there are also a lot of ways that we can stay connected today with all of the virtual and our cell phones, basically. They have a party app now, so everybody can get online and chat with each other. So use those apps, video calls, phone calls, all those things just to take care of yourself. We cannot be physically touching one another and in groups with one another, but we can definitely use our phones and stuff to chat and see faces. Continue to think positive. Of course, the situation is not the best situation to be in, but there could be absolute worse situations. It seems like things are getting better with some of the measures that we've taken, but continue to put yourself in a positive space. I can't stress that enough. Right now, of course, we're dealing with all the changes, and we're continually changing. You may hate working from home right now, but you might enjoy it by the end of this because you've probably gotten used to it. So things take time, but try and think positive. Let's see. The other thing, which is, I guess a lot of people are doing right now, is pursuing other things that they have been wanting to do for a while. And that is, I know I have people who have told me that they are going online and they're reading up on classes and that they're about to take. Get ahead. Take care of your financial needs. Of course, we're not out spending money at these restaurants and, theme parks and all of the stuff. So save your money. Go over your finances. Learn how to deal with your money. And all the other things, professionally and personally, just pursue any of those goals that you have or look into it, research them, develop them. And then lastly, if you need us, we're here. We are mental health services. We have disaster mental health as well, but there are a whole lot of other resources that we have available to you that you can call. And if you just need to talk to someone, if you're feeling anxious, if you're feeling sad, of course, during this time, during isolation, there are people who have depression and anxiety disorders that can get worse, obviously, during this time. So along with, thinking positive, be honest with yourself. If things aren't going so well for you, give us a call. Call any of these resources on the screen. If you don't want to call mental health right away, and you feel like your problem can be solved by someone else or just talking to someone else, definitely do that. Everyone up here is trained to point you in the right direction if the information or what you have is overload. So be honest with yourself as well. Arlene?
And some additional resources being that, I will say, and I can relate as a mother of 4 and getting adjusted to teleworking, there's a lot of wonderful apps out there that individuals could use if you want to, strengthen your relationship. For example, there's the Gottman card deck, and that's with over 4 decades of research with both doctors John and Julie Gottman. And you can learn more about your partners and enhance your relationships. Also, Love Nudge, which is provided and created by Dr. Gary, Gary Chapman, I apologize. And again, years of experience, and learn what's your partner's love language, and also learn about yourself. Parenting classes, there's also Parenting to Go. It was created for service members and veterans. However, we all can use it, benefit from it. Again, learn some new skills and techniques and to strengthen your household. Thrive is a site that is provided through Penn State University. Has a lot of wonderful resources. As a matter of fact, there are several free parenting classes that are quite in-depth and very helpful, and also has additional resources. Personal development, there's AIMS for individuals who are dealing with anger, irritability, and need some new management skills. It would be able to help you learn how to not react to those triggers that normally individuals are facing, especially for those of us who are, many of us who are in the home with, with our whole routine is kind of has been changed, and trying to get things back into some norm. This may be helpful for you. Mindfulness. This app will help you have a routine and learn and practice different techniques of how to be mindful. And then moving forward, gain some new tools and learn to deal with those stressful moments, which many of us are encountering, and also to overcome those difficult problems that we have in our life. I will say that there are so many resources out there, not only online, but also still here at Edwards Air Force Base. And it's important for each of you to reach out. It's okay to say, you know what, I need additional help. And so if you are not sure which direction to go to and you need some additional resources, don't hesitate to give our clinic a call. You can reach us at 277-5292. Just ask for me, Arlene Johnson, the outreach manager, and I'll help guide you and do a warm handoff to the services that you need. Thank you.
Thank you, Miss Arlene. Thank you, Captain Hoffman. Slide. So before we turn it over to answer your questions again, we need your help to continue to flatten that curve. You heard Captain Lankert bring up that outside our gates there is definitely still that widespread transmission, and so we have to play our part to help that continue to go down the way it needs to. So continue to cover your cough, wash your hands, use your cloth mask, do everything to protect yourself and protect your loved ones, and we will continue to do everything to protect you and to strengthen our community. So please do not hesitate to contact us. Use our appointment line for your healthcare needs and any questions you may have throughout this journey, because again, we are in this together. Thank you so much for tuning in, and now we're going to turn it over for your questions. Chief.
Yes, ma'am. So our first question that we received earlier in the week was, I would like to know if the antibody test for COVID-19 is available on base, and if not, when and if it's expected to be available. If not, okay, that's the first part of the question. We'll hit that one right now. Right now, our small lab does not have this particular antibody testing available. A lot of the tests that have been developed are still very new. We are waiting for the proper accuracy and then, of course, the need to have that here in our little lab. Our reference labs are also not available to do this. They don't have it available right now, but they are looking into it, particularly the large epi lab at Wright-Patterson that we send many of our samples to. So more to come on that. Now, the second part of the question, if not available, will TRICARE cover this test at an independent practitioner's office off base? And will a referral be required? Short answer to that is yes. They have to make it a medical necessity, excuse me. So a provider does have to determine that that test is medically necessary for it to be approved by TRICARE. If you want to get it just because you want to know, the best thing for you to do is contact your provider, who could then possibly deem it necessary if that's the case for your situation. For things that are urgent care, dependents, retirees, you don't need a referral to go get urgent care to get tested if you have the virus, if that urgent care deems it necessary to test. Active duty to go to urgent care, you always need that referral. And now we're waiting for more questions. For those who just came on, just letting you know, we have our public health expert here, Captain Lankert. We have Colonel Foster, our Med Group Commander. We have Captain Hoffman, our psychiatrist, and Miss Arlene Johnson, our family advocacy expert. So please bring those questions in. We can take them on Facebook or by texting the number you see on your screen.
Thanks, Chief. And I just want to pile on a little bit with the, when you're talking about the urgent care. So for our active duty folks, so if you call the nurse advice line and they direct you to go to urgent care, that is considered a referral. So please, if it's after duty hours and you've called the now and they are directing you somewhere, you are covered. If it's during duty hours, you call the appointment line, and if it is something that we deem that you need to go off base for, we will also put in that referral. So just to make sure that you are aware of that. Thank you.
Captain Lankard, we get a lot of questions about, okay, somebody's feeling sick. Do they call you at public health or do they call the appointment line?
That's a great question, Chief. So yeah, no matter what, it should always start with calling your provider, calling the appointment line, and getting that medical evaluation first. The doctors and the providers are in constant contact with us. So they will, if it ends up being a COVID concern, they'll then contact us. We'll start doing our contact tracing or whatever the situation does. We consult with them all the time. So definitely recommend calling your provider, trying to get an appointment, trying to get seen first. And they can even do on-phone triage as well. But that's kind of like the gateway entry point for a lot of stuff. And then we will be brought into the process depending on what the situation is.
Thank you. Yeah. We just got a question. Will today's slide be available on Facebook due to the great resources? And yes, we will absolutely post that. All right. Captain Hoffman, can you speak about the disaster mental health services that are available? Are those for civilians, dependents?
Yes, I'll talk about that. So disaster mental health is a service that we make available for everyone who's around, civilians and active duty. You just give us a call. Basically, call the mental health. Call us at mental health, and we'll get you in contact with anyone who can handle your issues. And so we basically offer 4 undocumented sessions, and that means that no one knows about what's happening with you, and it doesn't go into our computers. And so you get to do that, express however. Now, we do take our own precautions and let you know, and we will let you know, I'll let you know now, that whenever there's suicidal, homicidal thoughts, or if there's issues with you taking care of yourself, or things that we see that are a little bit more advanced at our mental health related, we do have to take that into account and see who we need to contact for that. That is kind of considered an emergency. So,
Thank you, sir. If my children are struggling with adapting to online school, who is available to help?
it's not me.
So I would reach out to the MFLAX, and that's where the slides were. I apologize, I don't know their number off the top of my head. But on the slides that you will receive or have access to, you would be able to make a phone call to the MFLAX, which is the Military Life Consultants, and schedule an appointment. Leave a message with them, and they'll get back to you soon after to schedule an appointment. So they do have 4 different MFLAX, one for the adults, one for the schools, and also for the CDCs. So they would be available. And you also can go through EAP, which is the Employee Assistance Program for civilians. That is available as well. And the number, again, is provided on the slide. Another useful tool is also to access on Facebook is the Edwards Air Force Community Connection site, which will have several different helping agencies, which is also another good resource. And also, again, if you're still not able to access the services that you need, please don't hesitate to give me a call, and I will do a warm handoff, and I'll find a way to meet those needs. Again, we're all in this together, and children and adults are it is a difficult time struggling through it. I have to say that I have a great deal of respect. I had respect before, but now it's a whole different level, being that I'm not only teleworking, but also now an educator for my kids, and so I completely understand it is a struggle. And that's why I would follow the guidance of making sure you maintain that routine for the kids, regardless of whether you are physically going someplace. Maintain that routine. It's extremely important, as if you are going to regular school. And then, of course, reach out to your educators, the providers of schools. I'm sure they have additional resources for you. The teachers are available if you need some guidance as far as like the schoolwork and what have you.
Thank you, Ms. Johnson.
Mm-hmm.
April is the month of the military child.
Yes.
I believe tomorrow we'll have a parade at 1300. You can meet at Branch Elementary, dress up in purple, decorate your car, and they'll be driving through the neighborhood to really celebrate our military children. One more way we can contribute. We're still waiting on a few more questions to come in. Is there anything that anybody would like to address right now? Some common questions that might come up outside of this forum that we could just address here?
I will say that on the apps that were provided, there are numerous apps. Do your research. There's a whole list, because maybe one app doesn't work for you or resource, and maybe there's another one that's a better fit. But the beautiful thing about the apps is that, and not only the research that is behind each of those in those websites, is that it links you to additional resources, and they are just an excellent tool to have in your pocket. And maybe you're not the one who needs those services or that app. Maybe someone else might need those services. So it's good to have those on hand so you can pass them off to your neighbor. And so just highly recommend it, just to take a look at it and check it out, and wish you the best and stay safe.
Thank you. Captain Lankard, could you explain some of the terminology? We hear about quarantine a lot versus isolation. If you could talk to us about those terms and what they really mean.
Yeah, definitely. So that's a common question, the quarantine versus isolation. You won't necessarily even hear it used correctly even in the media. So I think that is important to kind of determine those two things. So isolation is what happens if you're sick. So if I have COVID and I'm symptomatic, I will be put into isolation. So you're literally, the ROEs for them are similar, but it's basically you will hang out, you will get better, and you will literally isolate yourself off from the rest of the population, essentially. Even in some cases, if you live with people that are immunocompromised or other, or have other dependents in your household, you should be isolating yourself into a room until you are no longer symptomatic, and then you're cleared by a doctor. So it's pretty much the strictest one. Now, quarantine, which you'll see used in a variety of settings, including mass media. For example, a lot of zombie movies talk about quarantine, and that's where usually the government comes in and shuts everything down and keeps everybody there. That's not necessarily true. So quarantine is if you have an exposure, or they think that you have an exposure. So, for example, like if there was someone that had COVID and I was on a cruise ship or whatnot, and they were close to me, it's not necessarily, you're not sick yet. You might become sick, and because of that, and because we don't know if you're going to become sick or not, it's basically cordoning you off into your own home, usually your own facility, whatnot, and they're basically just hanging out for the incubation period of the disease. So that's how long the disease usually takes to start showing signs and symptoms in your body. So basically, it's a precautionary step in order to take a population that has some sort of exposure but might not necessarily be getting sick. But that way, if they do become sick, it can be controlled, and they can be then moved to isolation. So you'll see it used different ways. Just because you're in quarantine doesn't mean you're going to get sick. It doesn't mean you're not going to get sick. Obviously, the dose makes the poison, kind of. So if you're around someone that's coughing a lot and really, really exposing you, you're more likely to actually get ill versus if you had just a minor exposure. But those people are then put into their own little area away from, again, the general population. So there's less of a risk if they do start to become symptomatic, and that way can also be identified quicker as well. So those are kind of the difference. One is you're actually sick. No joke, you have the disease, or you're suspected to have the disease, but you're symptomatic, so that means you're infectious. The other one is we don't know if you're going to get sick. At the time you're not symptomatic, you're not necessarily spreading the disease, but we're just waiting to see if you end up doing that, which is why they get released after the incubation period's over. Because that means, all right, well, if you didn't get sick then, you're not going to necessarily get sick.
Thank you, ma'am.
And Captain Lankard, could you explain self-monitoring? Because sometimes we hear folks saying that too.
Absolutely. So self-monitoring is kind of a third category. So that's like for basically everybody on Edwards Air Force Base or in the nation really right now should be kind of self-monitoring. That's basically self-checking yourself for symptoms. So right now we're looking for fever, cough, shortness of breath are the big three essentially for COVID. So every day, especially in healthcare, we're all self-monitoring ourselves at least twice a day. For fever, so it's basically just asking yourself, do I feel hot? Do I feel like I have a fever? Is it explained? Is it not? Ideally, you'd be able to take your temperature twice a day, looking for that 100.4, I believe, is the threshold-ish, but just seeing if you have a temperature. And then just literally just internally checking yourself, saying, do I have a cough right now? Am I feeling sick? Am I feeling ill? So that's pretty much what the self-monitoring is. We usually use that for people, well, right now it's for everybody, essentially, because we're all kind of have similar risks because the entire nation is at risk for COVID. And like I mentioned, for outside the local area as well. But we also use it for people that really didn't have an exposure but have something else going on where they're not sure, or they're like, hey, I feel kind of weird, but it's just self-monitoring yourself to say, am I sick today? And then if the answer to that question is yes, call your PCM, get seen, get evaluated, and then we kind of go from there. And you could be sick with COVID, you could be sick with not COVID. Most likely it's not going to be COVID, but it's still being very mindful of your health status, essentially, is what self-monitoring is.
Thank you.
All right, Colonel Foster, is the med group set to open on May 11th?
Yes, we will be open May 11th.
Okay, thank you. Although our services are reduced, you will see that posted on our Facebook page along with these slides, just so you can see what those services look like. As we go further into this response, we can add more services in, or we may have to reduce more services. So the best place to look for that is our Med Group Facebook page. All right, Captain Lankard, can you review how many people that are on Edwards that have confirmed results, how many that work on Edwards but live off base, and how many in the surrounding communities? such as Rosamond, North Edwards, California City, Tehachapi, that you are aware of confirmed positive?
So I know for one thing we can't give this base specific numbers off, and I know that that's a common question. So we right now we're not authorized to give base specific numbers. However, we are factored into Kern County because we're in Kern County. I don't have the numbers precisely off the top of my head, but the first slide that I did, or the second slide that came up, shows Palmdale, shows Lancaster, so our immediate local area, because realistically that's where most people are going to go, especially right now that LA is kind of cut off because of policy, essentially, because their local area is defined right outside of LA. Kern County has had quite an increase in cases recently, mainly driven by Bakersfield. They've had a really, really large spike. They basically went from having a handful of cases a day last month-ish, and then all of a sudden they had like 25, and then it's just been kind of escalating from there. So Bakersfield is definitely a more of a hotbed, one would say. The caveat to all of this is we only know what's being tested for, so if they are testing more than other areas, that might explain some of it, but regardless, it's to highlight the fact that it is in our local community. Tehachapi has not been hit very hard by that. I don't have the exact numbers off the top of my head, but the last time I checked, it was something like 3. It's not really, they're pretty isolated up there as well, but obviously that can always change because everybody's transient and we can go from different locations. But right now Palmdale has seen the biggest jump recently, and most of that is because of the backlog in tests. So it's been there, it's been circulating, and as we all know, Lancaster and Palmdale have very, very permeable borders. They're pretty much all one area, so if it's in Palmdale, you can imagine that Lancaster's seeing similar stuff. All it really matters at that point is what place reported it, where were they tested at, where were they confirmed at. So yeah, the local area is still increasing. LA is still seeing those sharp jumps, mainly because of the backlog as well. But at the same time, Rosamond doesn't have Rosamond-specific statistics necessarily. But there hasn't been some crazy amount of cases like there has been in Palmdale, but it's also given to the fact that Rosamond's much smaller than the rest of our local population. So I don't have the numbers off the top of my head. You can see them on the slide before this, but and Kern County also has a dashboard that if you go to their website, they'll show you all the cases, and they'll shred it out too by like location a little bit, and then LA County is who reports on Lancaster and Palmdale if you want to look that up yourself as well.
Thank you, ma'am. Captain Hoffman, we have a question, someone who may have missed your slide earlier. What are some mental health coping skills that you would recommend to our military members and families who are in isolation?
So again, coming back to the resilience, getting back to practicing things that you would normally do when you're in a stressful situation, job change, or any of those types of things. Of course, we're going through this as a world now, so that's a little bit different, but also works for us. But in the slides that you'll see posted on the website later, you'll see that I mentioned like accepting the change and kind of going with it. One of the biggest things that I actually want to hit on with the last question is accepting the facts about our current situation, right? And so we are in a pandemic, and we are experiencing this virus, and most of the things that we know about this virus are unknown, right? And so take that back. So most of the things about this virus is unknown. And so kind of watching TV and getting numbers from the news and things like that kind of heightens our anxiety and kind of makes us a little bit more, I guess, angry, or it's messing up our mental health. So taking the news, watching the news, all that kind of stuff kind of, it heightens our anxieties, and it kind of takes us out of context, and it takes us out of the present moment of what the facts are. So going back to that, we do know that the numbers are increasing, the cases are increasing, the deaths are increasing. Oh my God, what's happening? But what you'll see is the numbers are increasing, but the deaths are also increasing, but there's a wide range of that, right? So that means that people aren't actually dying so heavily from this disease. The number of cases that we have outweigh the number of deaths by far, right? And so just trying to ease ourselves down with that fact, the likelihood that if I get this illness, the likelihood of me surviving is great, right? And then we do have methods that are working, like the social isolation and the mask, and well, mask is to be debated, but washing our hands and things like that. So taking all of those things into account and the facts about the situation, worrying about specific numbers and things like that aren't particularly really useful to us while we're in our homes doing what we're going to do tomorrow. So keep ourselves just bringing that up front. And so accepting things, accepting the facts of the situation, accepting what is, not trying to think about the future and when we're going to be coming out, things like that, because we'll be prepared for that when the time comes. Going back to apps and using the internet and using all sorts of things to kind of get us in a mental space where we can bring ourselves down if we are anxious or angry or dealing in a household that may be a little bit chaotic right now, and all the changes that we have right now. So getting on those apps and utilizing those. There's Google, there's Facebook, there are apps for social connections, actually. So while we cannot be present with each other physically, we can still have those social connections. So pick up the phone, call your friends and family, FaceTime them, or if you don't have an Apple phone and your text messages are green, then use whatever apps are out there, Zoom and stuff like that. So stay connected, do all the things that you can do to bring that anxiety down, accept the facts of the situation, of what's happening with us right here and right now, and we should be able to get through this.
Thank you, Captain Hoffman. Captain Lankard, is there a big difference between shopping at the commissary and shopping in town? Is the commissary much safer?
So it's really hard to put a precise measurement on safety. So what the commissary is doing right now is directly in line with the recommendations from the CDC, from what our office has been recommending, from what Big Public Health and the Air Force has been recommending. And they're following basically similar procedures from Albertsons. So the main primary objective of keeping yourself safe is the social distancing, and then as the follow-on is using the correct personal protective equipment, or PPE. So that would be, in the course of this situation, it'd be using those masks if you cannot maintain the 6-foot distance. So right now our commissary is limiting the amount of people that goes into the commissary pretty significantly, which is similar to what other grocery stores are doing as well. They're establishing the one lane of traffic, basically transmission routes, where you can only go one way down the aisle. That's the same with off base. So they're basically practicing the same level of protections as off bases. So to say one's safer, one's not, a lot of that relies on the individual following the procedures that are already in place in both those facilities, and then maintaining that social distancing, washing your hands, doing all the other personal stuff. So a lot of the safety aspects of COVID really do come down truly to the individual. Are you washing your hands like you're supposed to? Are you using hand sanitizer when appropriate when you're not able to wash your hands? Are you covering your cough? Exactly. Good demonstration. I love it. Are you covering your cough, like with the whole like Batman or vampire thing? And then are you maintaining those 6 feet of distance, and are you self-monitoring yourself, and are you not going into work when you're sick, essentially? So if you do all those things as a person, and everybody else does those things, the system works. So the commissary is absolutely doing what they should be doing as far as maximizing and making an environment where people can be safe, but it really is up to the individual on whether or not they follow through with those procedures.
Thank you, ma'am. And with that was our last question. Does anybody have any closing remarks that they would like to say?
I just want to say thank you again for tuning in. We cannot get through this without you, so it is all of us together, and that is whole of nation, whole of government, and we look forward to talking with you again next week. Thank you.